Hello, and how are you? Welcome to our session on health planning at the community level. My name is Winnie Barawa. If you're new here, feel free to subscribe and share our content with your network. And if you're a returning viewer, thank you very much as you keep supporting our network for the growth and purpose of learning in the field of medics. So when we look at planning units, we discussed that the community unit is the lowest unit when it comes to generation of annual work plan. And for that, we need to first understand what are the responsibility and the participants at the community level in our health service delivery systems. So at the community level, what we call as CHWs, this is a level whereby we are in direct contact with our community, and the main composition of this unit is through the CHWs and the CHWs. Here, by CHW, we refers to community health extension workers and the community health workers. So the community unit or the community planning unit most of the time is given the responsibility of providing health messages or health education to the community members, and the team is made up of the ratio whereby one community health workers is supposed to cover 20 to 50 households, and they're supposed to meet this household at least once in every quarter in a year. They can also treat minor illnesses or minor ailments through the guidance, of course, of the team leader, which is normally the facility in charges at the lowest level. The other function that the community units through the CHWs and the CHWs is referral of patients to the appropriate health facilities. In case of emergencies that they have identified in the community, they can normally supposed to refer to the facility that is existing. They're also supposed to collect household information, for example, cases of immunization, injuries, disability, and any related illness-related information. They also help in mobilizing community for outreach services. For example, in states where we want to conduct a medical camps, then we're allowed to work with the the CHWs or the CHWs to generate, numbers or to get participants to attend the given outreach services. They also help in organizing health action days to address environmental health problems. For example, in breakouts of cholera outbreaks or general outbreaks in the community, they really help in promoting health actions to address such illnesses or to address such health problems. So as you can see, the community unit is a very important unit in our health service delivery as they form the lowest level of our delivery system, but they are in direct contact with members of the community unit can participate in promoting development of the annual work plans. So in development of the annual work plans at the community level, number one, we need the team, and the team at the community level is made up of the facility in charge, that is the dispensary or the health centers, composed of also with the CHWs and the community health workers. So what are the responsibility of these different teams is that the health facility in charge, the main role is to participate in orientation of the CHWs and the CHWs, teaching them on what it means to develop the planning guide, the format, to understand the compositions of the annual plans in terms of, for example, the demographics, to understand, for example, the implementation mechanisms and all those. And with that, the CHWs now come in to coordinate and lead the process of developing this plan, to orient also the CHWs and to come up with analysis that will later on be used in summarizing our plan at the end of the day. So the CHWs, which are like the lowest level of cadre at the community level, they really help a lot in contributing to development of the specific baselines and targets that will be needed to be achieved by the planning period. For example, if there's an outbreak or there's an increase in malarial cases, then the CHWs can advise what exactly can they do, because if they're in charge of household level, then they can even give specific names of households that have been severely affected by given illnesses. And with this, they now form what they call the Community Health Committee. So the Community Health Committee thus will have the membership of the health facility in charge, the CHWs, and the community health workers. So they will, all of them now give a common agreement on the priorities, and they will endorse the final plan that will be ready to be consolidated at the next level of the planning unit, which we will later on see is at the level of primary healthcare level. So moving on, still processing on the community planning unit, the leadership of this planning unit is headed by the community health extension worker. However, the plan or the committee will work together with partnership, including partners, for example, uh, from organizations or civil society organizations, NGOs, faith-based organizations. All these are partners that work together with the community to not only implement project, but they also work together to put inputs into the final document when it comes to the plan. So what is the process and timelines when you're conducting the community level annual planning? So what happens is this takes a minimum of at least 7 to 10 days. That is the required period you can take. And on day one, you're told this is the day you spend to just orient the CHWs and the CHWs in terms of the guidelines needed to develop the plan, the format to use, the agreed information that you'll want to put in the plan. And then the second day is engaging the committee on areas of priority, generating broad targets, and seeing what can be achieved while we are developing the annual plan. So the day one is orientation day. Day two is engaging and developing targets and priorities. But we are talking of 10 days. What next should happen in the following days? So in the following days, targeting day 3 and 6. So with day 3 to 6, there's more engagement, working closely with the CHWs and the CHWs, mainly to provide baselines and targets for the different indicators. So based on the indicator we've selected, if it is maternal health, child health, elderly care, you come up with specific indicators for all these. And day 7 now is compilation of the whole plan based on the format that they had agreed on, based on the baseline indicators that they are working together with, and the activities they have agreed to do. And with this, we are finalizing by day 8, we have completed the plan. We are finalizing, that is finalizing on the discussion and preparing for the endorsements, which now by day 10, we are expected that the CHWs or the team should be planning to present the endorsed plan to the health facility level, who will now take it to the sub-county and the county levels. So these are the basic steps of processing or following the timeline for developing the annual plan at the community unit level. These are the steps. So there are 5 steps: situation analysis. Step 3 is problem analysis and priority setting, target setting, implementation planning, and cost and budgeting. So these are the basic steps for any planning cycle, but thinking of the different levels that you are engaging at the community level, the steps are very short. They're not as detailed as they might have been in the planning cycle, but the basis of it all follows this summary. But at the end of the day, it means the targets need to be set, the priority areas need to be clear, and the implementation plan, cost and budgets need to at least feature in the annual plan that they are coming together for. So once this is done, they will now forward this to the second level, and that is the primary level, and it will be discussed further from there for the information to be passed to the next leadership until final document is generated. On developing an annual plan at the community level. So if you are new, kindly remember to subscribe, and if you enjoy our work, share, comment, and like. And until we meet again in our next session, bye bye.